Thank you for listening to GCN. Be sure to visit GCNlive.com today.
Welcome back to the NutriMedical Report and Dr. Nick Martin. Dr. Martin, the supplement called MitoRestore, of course, has higher levels of activated vitamins than you'll find in any vitamin anywhere to overcome this Syndrome X. And what we're seeing is a massive increase in not only Syndrome X or obesity in the population, because everyone who's overweight has Syndrome X. It's a prelude to development of diabetes. It's a prelude to vascular disease, dementia. The latest research now published this last week that diabetics in their 50s have early changes, which mean they're going to have reduced cognitive function as early as their fifth decade. This is a pretty big deal. Can you give us some ideas of how rapidly this should be implemented by doctors right across the country? Is this approach toward medicine, looking at genes, epigenesis, the diet, like the corn syrup, is a big deal. It shouldn't be in bread or foods because it dries up this hormone you mentioned, ghrelin, which actually makes the appetite go out of control, but also has its other toxic effects.
Well, since it does stimulate ghrelin, and since it does cause people to overeat in that group, and it's interesting, it doesn't do that in certain people that don't have the metabolic syndrome. In other words, if you're a thin person and you eat corn, it doesn't tend to cause you to gain weight if you don't have those genetic findings that we've been finding in these people where they're, if you give them, for instance, if you give a person with a metabolic syndrome, you give him just a normal vitamin B6 that you get in a drugstore, his B6 will elevate and it becomes toxic. And this is toxic to his nerves, so it causes a neuropathy. And on the other hand, when you take an activated B6, which is at the right, at the levels to work, you'd think, well, that's too much, that will poison somebody, but it's been shown quite clearly in research that activated B6 does not have any toxicity.
Yeah, that's really interesting. It means, and that's why they've had this recommendation of don't give anybody more than 100 milligrams of B6. It's because it's not activated. And if you're pre-diabetic or have Syndrome X or one of these gene polymorphisms, you can get polyneuropathy caused by it. But if you don't, it's actually going to reverse and prevent central body obesity and these other problems. That's how amazing the level of science and practice, I think, is going to have to be bumped up a few notches. Our doctors in the future are going to have to be trained in doing what I call functional epigenetic and genetic medicine. They're going to have to know how to use nutrients like a scalpel on a metabolic level, just like you're teaching, so that they can actually fix people rather than just going in and say, well, we'll do a banding, and when your stomach is 50 centimeter, cc size, you'll stop eating. When really that's not the problem. It's a metabolic problem and a genetic problem and an epigenetic because they're getting corn in their diet that dries up ghrelin if they have these problems.
Right. When it doesn't dry it up, it stimulates it.
Yes, drives it up. Drives it up.
Drives it up out of the stomach, drives it up in formation.
Yeah,
that's why when they go in and cut out the stomach or they ban the stomach in those areas, the stomach isn't stimulated as much because when part of the reason the gruelin's formed is when the food, it gets in the stomach and expands it. So when they band it like that, they prevent the expansion, and sometimes they go in and cut out the part of the stomach that's producing the grelin, which also helps.
Right.
But the issue is just to get rid of the corn. So the corn syrup people realize that there's been a lot of people dropping the use of corn syrup, so they've been putting out all this propaganda that their studies show it didn't bother any of these skinny people. And I said, well, big deal. It's not supposed to, because those people don't have the same genetics this will happen in them. But I guess they're estimated in most areas of this country it's around 50 to 60% of the people, and I guess in Kentucky it's probably closer to 75 to 80% of the people have some component of metabolic syndrome, I would guess, just by seeing my patients.
Yeah.
But again, probably the people that are skinny and well don't come to the doctor, but anyway, at least 80% of our patients that walk in the door have some components of it. And I guess one of the biggest component of it is the fact that the same defect in activating in enzymatic problems that cause having to have high levels of activated cofactors, that same enzymatic problem occurs in your immune system also. And to keep your immune system normal, you have to have adequate amount of P5P at a high level in these people, or they end up getting into allergies and gluten sensitivity and casein sensitivity, and they end up getting autoimmune diseases, everything, like we talked about earlier, thyroiditis to ulcerative colitis to rheumatoid arthritis to psoriasis and psoriatic arthritis, and all those things. And it all goes back to similar genes and similar enzymes in different components of your metabolism in your body.
Yeah,
and
it's
so
also
as we start to
interesting.
identify those areas and we start to treat them. I mean, I had a lady came to me for a long time teacher. She was her math scores weren't doing too well, and she said she could only walk about 20 feet, and she had psoriasis and psoriatic arthritis, and her hands were deformed and everything else. And she wrote me a letter recently. She said, when I came to you, I walked 20 feet. I walked 11 miles yesterday. And she says, my math scores are up 30%. I can now start to use my hands. My psoriasis is almost all gone, and I'm not sore anymore. And,
Wow.
That's the components of autoimmune disease showing up in many parts of her body, as well as the fact she was extremely fatigued. And fatigue is still the biggest thing that people, I guess the major thing that people walk in my office with, Doc, I'm just fatigued. I just don't have the energy anymore. And if you go back to it, if you don't have the enzymes, what makes your energy? Enzymes. I mean,
right.
You don't get energy out of taking sugar in your body without using enzymes to convert it to ATP.
Right. Now, this is a very, very big breakthrough that you've made here, because tying in the gene polymorphisms, and I think it should be a standard of care in the next few years as we get the test popularized to measure the combinations of genes, to measure the levels. In fact, as the latest news article, that Quest has had some problems with their testing in the lab and LabCorp. Obviously they use different techniques for measuring vitamin D levels, and it's a big problem. Can you talk about that for a moment? Because people need to realize that these things should be parts of a doctor's training. They shouldn't just be trained to push drugs. They should be trained to actually test, because every patient is individual. Even a diabetic, there's different groups of genes and deficiencies that cause one person to get in trouble versus another, although there's a grab bag of a certain half dozen or so genes that are the most common causes that push people over the edge.
But you have to have good tests, and what's happening is Quest and LabCorp are like Walmarts in the sense of that they don't do all their own testing. They bring in other people's test results and they sell them. Okay,
right.
And so some of these people don't. They don't have good tests for certain things. For instance, we have, and nobody has a good test for some things that we need. For instance, we're looking at vitamin D. Well, determining when vitamin D gets toxic is really tough, because vitamin D is carried through the blood in a protein boat-like, because the blood's like a water and vitamin D is like fat and it doesn't mix. So there's a protein that carries it through the blood, and that protein determines how much you find in the blood. And so right now we're having a hard time measuring that protein that carries vitamin D. In fact, I've got the head of the local university lab here looking to try to find one that's dependable. On the other hand, measuring the active part of vitamin D is really hard. We measure a vitamin D, but it's not the really active part. And right now, trying to get that done correctly is really tough. I tried to get it done the other day and through a lab, and one of the labs, and they just couldn't do it. And so it turns out that sometimes LabCorp will not do what you need to do, and sometimes Quest won't do what you need to do. And, of course, you can only contract with one of them at a time. So sometimes you end up having to send somebody someplace else out of your office if you've contracted with one lab to get another test. But you always try to contract with a lab that can do the most right test. But it's a difficult thing in evaluaing people. All these things have to change. I met with a dean at the local university where I used to teach, and I showed him, talked to him a little bit about some of my data. I had some testimonials sent to him, and I said, we need to look at changing teaching, and we need to look at changing approaches. Right now you got doctors being extension agents to pharmaceutical companies. So
they're basically they're salesmen.
He has a problem, and the doctor says, which pharmaceutical has something I can give you? And that's not the way it should be practiced.
No. In fact, they have to use their brain. Most people don't realize doing a surgical procedure, doing many medical procedures doesn't take very much brains or training. You can train somebody within a matter of months, but learning how to use your intellect to actually figure out what's wrong with the patient and fixing the problem, that's difficult.
We just need a better teaching system.
Absolutely, and you're one of the best teachers. We'll be back in a moment with Dr. Nick Martin. Syndrome X is the biggest public health disaster in the Western world, and we're seeing one of the scientists and doctors that's solving those problems today. We'll be back in a moment.